Hello, my name is Jenna Philippone, and I am here presenting to you for the Adapted Physical Education program at Westchester University. This class is KIN 579, Inclusion Practices in Adapted Physical Education. I ask that you please I'm going to be referencing the textbook that we do have, as well as the PowerPoint. I ask that you do open the PowerPoint and follow along to what I'm saying. Today we're going to be talking about a team approach to inclusion in adapted physical education. This is chapter 3 of your book. The objectives of today's is to define what a collaborative team is, identify the key professionals who are part of this collaborative team, their roles, and how they can be used as resources amongst each other within the team, as well as the key to communicating. Communicating when it comes to a collaborative team is so important, and I will continually stress that over the course of this presentation. Before we get started, some important background information. Collaborative team all starts when a child has an IEP. An IEP is an individualized education plan. IDEA 2004 stated that an IEP should be created by a team of people, which should include the students, the parents, the classroom teacher, the special education teachers, therapists, and a representative from a local agency. Before IDEA 2004, they used the pull-out method. This is very common and still sometimes seen today, but not as common, and students were pulled out of the classroom to work with a specialist. This can be good, but it doesn't allow the specialist to learn about the general education environment, and it doesn't allow them to share their info with the classroom teacher and the other teachers. So there's that lack of communication. An example of this, why this was so wrong, is not wrong, but not as useful, is because, say, as an adapted physical educator, you're teaching a child who's wheelchair bound how to go on and off a curb. Well, if you teach that to them pulled out in an outside environment, and the classroom teacher, other teachers don't know about this, they can't reinforce that skill being learned. So the skills being taught aren't always being reinforced. Later on, they decided that it would be best to have a team approach. This is when teachers collaborate with others to implement the child's IEP. This allows for shared resources, experiences, and knowledge. Teachers are able to talk to each other and be a resource to each other and ask questions and collaborate and problem solve. And it's important to remember, in a collaborative team, there is no I in team. Like the saying always says, you have to work together and communicate for there to be success. But what is a collaborative team? A collaborative team, like any team that you might be on, as an athlete myself, I know you always have to work together, is when two or more people work together to share information and responsibilities to achieve a common goal. This would be by working together to set goals, identifying problems, assessing the students' needs and skills, exchanging the info, brainstorming, problem solving, making plans, implementing plans, evaluating plans, making assessments. Everything that you could possibly done, they're working together to accomplish that. This allows for the programs to be integrated into the normal classroom settings. This model of a collaborative model was created by combining two models, the transdisciplinary model and the integrated therapy model. These two models combined together, created the collaborative team. The transdisciplinary model is when parents and teachers share techniques without any limitations. This allows a child to be more independent when participating in age-appropriate activities and routines. However, the child's taught in isolation, so once again, it's not very functional and the skills aren't being reinforced. The integrated therapy model is therapy is conducted within a functional manner. So it's combining these two with the functional and the non-functional instruction and making it work together. Characteristics of a collaborative model. If you look at textbook page 31, reference table 3.1, it describes these for you. But I'll read them along. But it's important before you even have a collaborative team working with a child is that you need to assess the student's current abilities to determine their present level before the team can decide on where to go. But a collaborative model, you need to have equal participation, shared responsibilities, interdependence, utilization, and functional setting. It has to have equal participation by family members and educational service providers, equal participation of all school disciplines to create an efficient IEP. That means everyone needs to be working together. The general classroom teacher, the general phys ed teacher, the advising adapted PE teacher, the special ed teacher, everyone needs to be working in unison together to help this child. Decisions made on a priority of accomplishing goals set at home, school, and the community. They need to decide there's going to be goals for home and school and the community, and when should these be accomplished? Should it be in a day, in a week, and down the road, in 6 months, or in a year? This is where we want to be in a year. And you need to decide which goals and when they should be accomplished by. The attention of all team members in monitoring and communication the needs and skills of the child. If a teacher says something, they need to say, hey, I saw this, and communicate it to the child. Much as if you have students yourself and you know so-and-so is not having a good day, you're going to relay that to the classroom teacher and say, hey, are you seeing the same thing? Is something going on? So just being aware of things that are going on and communicating the things that you see concerning to others. Combination of all team members to actively develop confidence and competence needed to help students achieve an IEP goal. Just making sure that you are covering all the bases and knowledgeable about what you're doing and confident. Confidence is key. I had my own experience. I was a long-term sub in Methacton School District teaching adapted PE. I had no experience teaching adapted PE, so my confidence wasn't really there, but with the support of the special education teacher and the aides and the paraprofessionals that I had and the principal, I felt more confident about taking on this task of teaching a middle school adapted PE class within the district, and I enjoyed it so much. That's why I'm getting and taking these courses to get certified in adapted PE. It had that much of an impact on my life. Collaboration of problem-solving techniques and responsibilities for students learning across all spectrums of the education plan. So it's important that everyone works together to problem solve and make sure things work out and all the goals are being met for the child. Well, what is the Physical Education Inclusion Team? PEIT, that's what it stands for, is the Physical Education Inclusion Team. This is made up of team members who can successfully plan and implement the physical education aspects of an IEP. These people are going to be your special educate, your general physical educator, and your adapted PE teacher. Usually, you also find the special education teacher because they're the ones that know the most about the child, and they're going to be also advising you on what goals should be met and can we cross-curricular disciplines and cover both goals so we can reinforce them. They should meet and collaborate on IEP goals, and they need to follow up with their meetings. If they meet once at the beginning of the year, they need to make sure that they follow up by emails and phone calls and additional meetings. It should be an ongoing process for the special education teacher and the general phys ed teacher, so to make sure that if the child's goals are being met, where they stand, and just continuing that communication. There should be alternative plans made by the physical education teacher for activities that the disabled child might not be able to participate during the physical education class. And if there is an alternative activity plan, this alternative activity should actually be targeted towards the IEP goal. So if a child is, for safety reasons, not able to participate safely in the general PE class, they should have an alternative activity plan so they're still being active, but that is targeted to their specific IEP goal. When meeting with the physical education integration team, the team is actually comprised of the adapted physical educator and the general physical educator. If you actually look at page, I want to say it's 34 and 35, figure 3.2 of your textbook, you'll see that there is actually meeting agendas and meeting minutes to track and log what actually was being discussed and documented. They need this documentation for legal forms, but it also helps you kind of figure out what's on the agenda, do we follow up when to do things. So I ask that you do check that out and see it in the instance that you do and you will be attending IEP meetings. So for the meeting of the physical education integration team, you can use one of these forms if you would like, but documentation is always important. So it's a combination of the general physical educator and adapted physical educator, their views. One or if not both should attend the IEP meeting. And during this meeting of the physical education integration team, it's going to be the whole collaborative team is going to have this role release scenario where you're going to have a role extension. Teachers are going to share with the team what they actually do, and then they're going to have a role enrichment and share their teaching practices with the other teachers. So what they do, how they do it, and the role expansion is where team members describe how to utilize their skills. So they're saying what they do, how they do it, and how the others can implement and share that resource within their classroom. And so it goes from the release to the enrichment to the expansion. And this is an ongoing process that happens with a collaborative team. And once again, I'm going to continually stress that communication is always very important during this. If you look on the next slide, it's going to tell you the members of a collaborative team. I'm not going to read these to you. I put a little circle diagram for you to see. There's a whole bunch of people that can be a part of a collaborative team. Not everyone needs to be present. You might not need a vision specialist, or you might not need a the recreational therapist, but these are all potential people that could be part of the collaborative team during an IEP meeting. To explain some of the team members and their roles, I'm going to go through them right now. First, let's start with the adapted physical educator. They're a very critical member of the team who provides information regarding motor performance. They assist in identifying any physical education problems or safety concerns for the disabled child. They assist in assessment, program planning, writing individual education plans, participating in IEP meetings, implementing programs for students with disabilities, consulting with the general physical educator, parents, fitness consultants, and advocating for the child in physical education and sports activities. They're going to really try to make sure that that child is being active as best as that they can. And just ways to be safe within the physical education activities. The general physical educator is going to share information pertaining to physical education that no one else can provide if the adaptive physical educator can't be there. So it's going to be the two of them working together, both providing that physical education info. One of the two will be providing it. It's important as the physical educators, many, as we heard in the last presentation in Chapter 1 and 2 aren't always certified. It's important that, for me, having my own experience, it's very important that I kept an open mind about the inclusion and attended IEP meetings as possible, and provided input about the physical education for the child with a disability. I didn't attend IEP meetings, however, I did get a chance to read over all of the IEP reports and sign off that I did read them. So sometimes you might not be able to attend the meetings because there are so many, and you do have to teach class and you can't always get to all the meetings. I did sign off on them saying I did read this, I do know, and I acknowledge the needs of the child. As far as the special educator goes and the collaborative team, they're the primary advocate and planner, supporter, organizer for the student with the disabilities. They actually know the most about the child, and other than the parent. They develop and assist in implementing the IEP. They coordinate all the support and related services the teacher needs, communicate important information to other team members, assist in training peer tutors and paraprofessionals. I also had the opportunity to be a paraprofessional in a school, and I was a one-on-one aide for a child who had a disability. So I also had the opportunity to be a paraprofessional and have that view of being a part of the team, as well as I've been on the teacher side of being a team member. So I've been kind of all around this team setting. The building principal they're not directly involved with the programming, but they're just responsible for everything that goes on within their school. So they need to just kind of be aware of this of the students and maybe what their needs are, but they should feel confident that their needs are being met by their staff. And if their needs aren't being met, maybe because of a lack of a resource, they can help provide that resource so that the needs can be met correctly. The school nurse involvement can vary depending on the extent and the level of the disability. They can be very involved or they cannot. They can help give medication, monitor health, carry out medical procedures, and act as a consultant to the team between the physicians and the school and the parents. So they kind of are a consultant working with the doctors and the school and the parents, and making sure that all plans are being followed through. The physical therapist, the PT, which you might commonly hear, and if you're in a school you probably might have known or seen them, they're helping improve the gross motor movements, the daily living skills, utilization of assisted devices, whether it's a walker or a wheelchair or something. They're helping the child learn how to use that functionally. They're preventing the onset or slowing of a progression of conditions resulting from the injury, disease, or other causes. It's important to remember that PT cannot replace PE. Physical therapists, their visits cannot replace, what they do with the student cannot replace the child actually going to physical education. Going to physical education cannot be replaced. Occupational therapists help improve, develop, and restore functions impaired or lost through illness, injury, or deprivation. These help individuals perform activities of daily living, help self-help skills, fine motor skills. They might also help implement a sensory integration program, which can help children who have sensory integration dysfunction, so helping them do that. They're very helpful. They can provide devices to help the child focus more readily in class, whether it's changing their seat to maybe an exercise ball as opposed to the classroom seat, to providing things to help them with their handwriting, different pencil grips and stuff of that sort. The recreational therapist, not very common, not very known, and that is because a doctor's referral is needed for this person to be a part of the team. And they commonly are seen working at a children's hospital or rehab centers. So they're not really in that school setting. They can help assist leisure functions, therapeutic recreation services, help, with community agencies. They can provide many programs for the child, like music and art and dance and drama, camping, sports, and fitness, horticulture. There's so many things that they can help provide the child within that recreation realm. However, these things are all not really seen at a school. If the child is that in need, they would more need a doctor's referral, or they would be working with them in a hospital or a rehab center. The speech therapist may not always be needed. Not every one of these is always needed, like always. They help diagnose specific disorders, provide speech and language services, help provide communication disorders, and provide support services to students, parents, and teachers. They provide information regarding the child's receptive and expressive language abilities, as well as their best way to communicate. So they're doing a lot of things regarding speech and language. Not everyone may need it, but some students may need it. The audiologist and the vision specialist. The audiologist is helping students who have some degree of hearing loss. They can help them learn how to use certain devices, whether it's a hearing aid or if the child needs to get a cochlear implant, how to use them and use them in the correct manner. They could help by having the right amplification system for the teachers. Maybe the teacher needs to wear a mic to help the student hear more readily, or tell the teacher, hey, if so-and-so isn't really paying attention, maybe the batteries of their actual hearing aid could be dead. I've had that experience before where I'm talking to the microphone of a child and he's not responding to me, and I'm looking and he's over in space, and next thing we know, at the end of class, he went back and his hearing aid actually died, so he could not hear, and he was just off the wall all over the place, but it's because he could not hear. The vision specialists help encourage movements, simulate the use of senses, and teach rereading skills and braille reading. So people that might be blind, they can help them just kind of aware themselves and help with their vision as best as possible. A paraprofessional is usually an aide within the school. The district will hire them. And they actually, if needed, they have the most one-on-one contact with the child. So they're going to be a great resource for the whole team. They might not always be in the meeting, but they're a great resource because they're going to see them, their different behavior patterns, their moods at different times of help everything that kind of can happen with the child. They're going to be there to collecting data, help monitor the student's behavior and collecting the data. But they're helping see that the goals are being met, but they're not actually a part of designing the plan. They just help make sure that things are being followed through. The parent, they're the number one advocate for this child, and they must be present at the IEP meeting, or at least given the opportunity to attend these meetings. IDEA of 2004 did state that they need to be present, or at least have the opportunity. School can't just do what they want. And it's important for them to attend because they have the most knowledge about their child. And if able, why not add the child as well? If the student can be present at the IEP meeting, and they not always appropriate, but if they're possible and they can attend, they should. Because if a child is part of the IEP and a part of planning their goals and when they should be met, they're going to be more motivated and committed to achieving them. The teachers, it teaches the child to be their own advocate. They should want to work and be vocal about what they want in life and their education plan. Before they even do attend a meeting, it is important to advise them what's going to be discussed, who's going to be there, what will be happening over the course of the meeting. Just kind of give them a heads up before they get to the meeting. You just don't want to throw them into a situation and they have no idea what's going on. It can be very overwhelming, especially with the amount of people that may attend the meeting. I've been talking about communication a lot, and the book describes how team members can communicate different ways to communicate effectively. And at one point in the book it said how team members communicate is actually more important than what they are communicating. It's important that team members can actually communicate in a respectful manner. They should establish open channels to communicate. There should be an open window where they feel free, that they can communicate their feelings to each other. They have to make sure that they feel comfortable and have gained that acceptance with team members. They should be comfortable being around them and discussing things with them, as well as creating that trust and that bond. Some people you might not feel, I don't want to tell them certain things, but they should be very comfortable, trustworthy, accepting, to tell what they feel to the teacher in the best interest of the child. They should be able to work through conflicts, come to a common ground, because in the end it's the child who we're here for and not for each other, and not getting upset over things that can be easily resolved. And listen to intent to fully understand. Sometimes we listen and you're sitting there and you're waiting and you're not really listening, and all you want to do is respond and talk and listen, not fully. So it's very important that when you're in a meeting that you listen with intent to understand and to digest what they're saying in a way that allows you to be more understanding about what's going on, not just to listen, to speak. I know everyone kind of has that that happens to them. I know I do. When I'm listening, I'm like, okay, and then I just want to tell you what my thoughts, and not fully taking in other people's thoughts and feelings. So overall, like I said, communication is key. Right now we're coming to the end of my presentation, but to summarize what I've discussed, I think it's important to say, we've discussed what a collaborative team is, the team members, their jobs, the importance of communication, and how to assist in the inclusion of physical education. And all of these team members are resources. So if you have a child who has a vision thing, you're going to want to talk to the vision specialist or the speech specialist. So all of these people are resources for the physical educator and for each other, so that they can better meet the child's needs. Many people are involved in the education plan, and they need to work together to share information and make important decisions. They're great resources for each other. The general physical educator really needs to get involved and be to better service the child and the children in their class. I kind of felt when I had my opportunity, I didn't get to attend the IEP meeting, so I kind of walked into a setting of 15 students with very, very different needs and disabilities, and I felt extremely overwhelmed. So I, right after class, immediately went down to the special education teacher and I said, I need to know about these students. So I sat there, I read the IEP report, she talked to me about them, I tried to meet with the other specialists. What are you doing? How how do I even go about teaching all these kids? There's so many different needs and disabilities, and as well as the other kids in the class. So I think being advocating and being involved and communicating that you want to be involved is very important as a physical educator. And once again, communication is key. Keep up, the communication, and with anything that you do, it's always important. I hope you enjoyed my presentation tonight about inclusion. And if you have any questions, please feel free to message me or message the questions that you have to post on the wiki space. I'll be interested to see what you have to say. And thank you for listening to my presentation. I hope you have a wonderful day.